Audio Jungle.
A very warm welcome to another Doctor to Health Mastery series, where we aim to enthuse, educate, and help you along that journey towards becoming master of your own health. Remember, nothing said here is a substitute for speaking to your doctor about any medical condition we may be discussing here. What I would like to talk to you about today is a skin condition called psoriasis. Now, the skin is the largest organ on the body, and there are things that happen on the skin that happen only to the skin, and there are conditions that happen on the skin that are actually a reflection of what's happening inside of us. Psoriasis is an inflammatory, immune-mediated skin condition, so it involves your immune system causing inflammation within the skin layers. And you have periods of exacerbation and periods of, relatively good skin. So it's a chronic, relapsing, remitting skin disease. It's the medical term that we use. It can involve the joints. People with psoriasis can actually get something called psoriatic arthropathy. It can also involve your nails. And nail involvement is a big clue to later joint disease, and it's really, really important, as I'll mention later on, if you've got any nail involvements, that we treat it aggressively. Now, psoriasis affects about 3% of the population, equally affecting men and women. It is relatively more uncommon in Oriental or Afro-Caribbean population, but also the presentation, how it looks, how it appears on a white skin compared to on a brown or black or darker complexion skin is different, making it more difficult to actually make the diagnosis. One of the biggest risk factors for psoriasis is having someone in the family who's already got psoriasis, so genetics play a significant role. In about 40 to 50% of the cases, people actually have another family member with psoriasis. And check this, if you develop psoriasis before the age of 20, so if you're quite young and you develop psoriasis, 75% of the time you have a family member who also has psoriasis. What we tend to see with psoriasis, we tend to see what we call a bimodal distributions. What does that mean? So that means we tend to see people developing psoriasis in young adulthood a lot of the time, and then you don't really see a lot of patients in their maybe late 30s, 40s, 50s, and then you see another group of patients developing psoriasis in their late 60s, 70s. But you can develop psoriasis at any age. Now, if you don't have any family member who has psoriasis at all, your lifetime risk of developing psoriasis is about 4%. So you can see how strong a role genetic plays in the development of psoriasis. Let us talk about signs and symptoms of psoriasis. Now, in the vast majority of cases, I'd say about 80 to 90% of cases, the typical presentation or appearance is something called plaque psoriasis. And this can affect the face and the scalp, but typically it tends to be on what we call the extensor surfaces of the body, so on the backs of your elbows, on your knees, but it can also be on your sides, on your shins, typically. The plaques have the following appearance, and this is the appearance on a white skin. It tends to be sort of salmon pink or ruby red with a silver lining on top. Okay, now it's not going to look this way on a darker complexion skin, on a black or brown skin, where it tends to be more skin complexion with a silvery appearance at the top, but you really won't find the typical appearance described in the textbook. So you need to see a doctor if you have a rash that's not going away, and this is true of any rashes. It's really, really important that you speak to a doctor, because it can be anything, and they can be quite challenging diagnosing them in blacker, darker complexion skin. What patients might find is that there are particular triggers of the psoriasis, or something that may have caused them to notice it for the very first time, and this includes periods of significant stress, smoking, alcohol, or trauma to the skin. Sudden infections such as streptococcal bacterial infection can also trigger psoriasis, or the use of certain medications, for example, hydroxychloroquine medication can trigger it. However, you'll also be interested to know that there are certain factors that help psoriasis, that relieve it. Pregnancy is one. So, women who have psoriasis will find generally that when they fall pregnant, the psoriasis will improve. but also sunlight. Sunlight is really, really important. And so one way of, at least getting towards curing your psoriasis or making it significantly better is taking regular holidays to somewhere hot. Somewhere in the tropics, Spain or Portugal, when there is no coronavirus, of course, and we're all allowed to travel to various places around the world. But I mention this because vitamin D is a very important part of the treatment of psoriasis, and we get a lot of our vitamin D from natural sunlight. How do we diagnose psoriasis? Well, we diagnose it based on the story, based on what you tell us, and based on the findings of those typical appearances that I've described. Now, I always say to my patients that when we see anyone, we see you on a continuum, and we may be seeing you at the beginning of an illness, or we may be seeing you towards the end. So at the beginning, you may not have that many symptoms or features present. Towards the middle and the end of that disease process, you may have lots of typical features, making the diagnosis a lot easier. So I always say bear that in mind, and this is especially true with skin conditions. We don't always get it right, and it's not uncommon perhaps for your doctor to treat you for an alternate skin condition, and only later on that it becomes really, really obvious. And you may see a different doctor later on, and it's not really a reflection that the first doctor wasn't a good doctor. It just means that there are now typical features that make the diagnosis a lot easier. So be patient, bear with your doctor. And for patients, and I've mentioned this several times, with that darker complexion skin, the challenge is even more difficult, because I'll tell you, in a lot of textbooks, the typical features of skin conditions are not on darker complexion skins. So if a doctor is not used to seeing rashes on dark complexion skins, on brown skin, black skin, it can be a little bit more challenging for you. Now, having said that, once we are sure that what you have is psoriasis, what's really, really important is characterizing the severity of the psoriasis. And we do that by assessing your percentage body surface area that is covered by a disease. Now, it's mild if it's less than 5%. It's moderate if it's occupying between 5 to 10% of your body surface area, and it's severe if it's over 10%. And this is really, really important, because if it's severe, it means, usually creams and topicals are not going to be enough alone. They will help, but they perhaps won't be enough alone. And you may actually need more newer drugs that we call biologics that modulate your immune system a lot better. And I mentioned at the very beginning that psoriasis is an immune-mediated inflammatory skin condition. What's also important is we need to check whether you've got any joint involvement or any nail involvement. These are quite significant factors as to the severity of the disease, because psoriatic arthropathy, so damage done to your joints by psoriasis, can be quite devastating. But actually, it's really, really treatable if we can just get the diagnosis right, and you can be given the specific treatment for that. Let's talk about the treatment of psoriasis. Now, before we even go into creams, potions, lotions, or tablet medications or injectable medications, what's really, really important is just having an awareness and being sympathetic with you, because skin diseases can cause significant impact to our quality of life. They can affect our intimate relationships. They can affect whether you wear short sleeve or long sleeves. They can affect leisure activities, for example, like going swimming. It can affect us. It can cause anxiety, depression in patients. But it's really, really important that we acknowledge this, and we do that very well at Doctor to You. Really, really also important that we give you a clear understanding of your disease process and what's likely to happen. And so, as I mentioned at the very beginning, psoriasis is a chronic illness. It's not something that's often cured and with one course of treatment and then never comes again. You may get flares, periods of exacerbation where it worsens, and then you need additional treatment, or you need to reinstate certain treatments again to bring it back under control. And it's really, really important to realize this before you even start any treatment. And it is also really important to avoid any of the prognosis with psoriasis is generally quite good if it can be diagnosed early and treatment started early. Also, really important to diagnose any nail involvement early. So look at your nails. Have you got any flaking nails, pitting of your nails? Are your nails coming off easily, for example? If you've got psoriasis and that's happening, that's really, really important, because that's often a sign of a greater likelihood of developing arthritis, psoriatic arthritis, which can be quite devastating if it develops, but easily treatable if it's diagnosed at the beginning and you can be put on the right medication. So, but overall, the prognosis is quite good. You'll have periods when it flares up, so it goes, you get lots of symptoms, patches come on, and it gets treated, and you have periods of keeping it well controlled. But the more you avoid the triggers, the more you take regular sort of vacation to sunny areas, or you take on board vitamin D, or use your emollients, or you start your topical medications such as the ones containing vitamin D or steroids early, based on advice from your GP or your dermatologist, the more you can keep it under control and stay on top of it. Now, as usual, we like to give you some health mastery tips to take away. So with regards to psoriasis, what you've got to think about is, have you got a rash with perhaps a salmon ruby pink appearance and silvery lining on top that's developing predominantly on the backs of your elbows or on the tops of your knees or your shin? And do you know anyone else in your family who's got similar rashes? If that's the case, then it may well be psoriasis. But the key thing is avoiding the triggers. So if you've already got psoriasis, avoid any stresses as much as you can, smoking, alcohol, and if it is possible, take vacation once a year to a hot climate. We know that sun really helps your psoriasis. Vitamin D is really important for the management of psoriasis, and just get a clear understanding in terms of what to do when you have those periods of exacerbation, because understanding that psoriasis is a chronic condition with periods of exacerbation is really important, and what you do during the exacerbations is really important. But really great importance is, if you have any skin condition, be it psoriasis or anything else, and you notice over a short period of time a rapid change in the size of the rash, a change in the color of the rash, a change in perhaps whether or not the rash has now gone from not being itchy to being particularly itchy. Has the rash started bleeding? Has the rash changed, become darker? If you notice anything like this at all, or if you've developed a different rash from the typical rashes that you've already had, any of these sudden rapid changes require urgent medical advice, because they may well suggest a change towards becoming cancerous, and that's important to pick up early, so you can be treated and cured of any potential skin cancer that may be developing. Well done for getting to the end of this video series on psoriasis. You are among 1% of the population that actually take charge of their health and wanting to improve their health, not just for themselves, but for your loved ones, because your health, I always say, your health having good health isn't just for you, but it's for your loved ones, perhaps your wife, husband, partner, children, family, friends. Whatever you learn from here, share it with your family and friends. And if there are any significant thoughts, any highlights for you, share it in the comments. That might just be the light bulb moment for someone else. If there's anything else that you'd like us to make a video on in the future, bring your suggestions forward. Thank you very much for watching. Remember, we're always here, very happy to help. If you want to speak to us about anything, pick up the phone, go on our website and browse. We at Dr. C will be extremely happy and delighted to help you out. Have a good rest of week, month, and stay safe.